live on HAPS TV. I thought that I would talk with you about the future of healthcare in the United States, given the death of Ruth Bader Ginsburg on Friday. So, for those who don't know, the Supreme Court decision on the Affordable Care Act is going to be happening sometime during this court on November 10th, just a little bit after the November election. The Supreme Court is going to be hearing a case that's going to determine the fate of the Affordable Care Act. The Supreme Court is going to be just hearing whether the United States government should strike down the entirety of the Affordable Care Act as unconstitutional. So the Trump administration is arguing that the entire Affordable Care Act is unconstitutional. The idea here is that the Supreme Court found in National Federation of Independent Business v. Sebelius in 2014 rather, that the mandate could be upheld as a tax on the individual penalty was construed as a tax rather than. So basically, what happened was in 2017, the Congress passed the Tax Cuts and Jobs Act which zeroed out the penalty. So all of a sudden, instead of having a $500 penalty for not buying into the Affordable Care Act marketplace plan, all of a sudden, no penalty anymore. So when the Supreme Court had found that the mandate was a tax, it was upheld as constitutional. It was found to be within Congress's power. All of a sudden, we no longer have a tax that's being enforced because it's $0. And so what that's essentially meaning is that there's a question about whether Congress continues to have power under its Article I authority. So when Ruth Bader Ginsburg was on the Supreme Court, there wasn't as much question about whether the Affordable Care Act was going to be upheld. It was likely going to be 5-4 with John Roberts writing the majority opinion, because John Roberts wrote the majority opinion in NFIB v. Sebelius. Roberts had been really, even though more on the conservative end of the spectrum, he was really one of the chief defenders of the Affordable Care Act. So we don't really have quite as much of a concern about him. The challenge right now is that John Roberts is now going to be presiding over an 8-8 court, a 4-4 court, an 8-member court, which means that the Supreme Court could essentially be deciding things 4-4. So what does that mean? Well, that means when the Supreme Court has a tie vote, whether because a justice dies or because a justice has recused from a case, such as from a conflict of interest, then we end up having the case go back down to the Court of Appeals. So what the Court of Appeals had said was that the district court essentially just had to add some clarity. The district judge in the Fifth Circuit had said that the entirety of the Affordable Care Act was unconstitutional. So Ruth Bader Ginsburg's death is not only going to have a lot of effect on reproductive health, but it's also going to mean that unless there is a 5-3 vote, which would mean that Neil Gorsuch would have to side with the liberals on the Affordable Care Act, the healthcare decision is going to go back down to the circuit that is pretty conservative and that has been deciding against the Affordable Care Act. So this is going to be a really monumental case. Again, Supreme Court's hearing this on November 10th. One of the reasons why this is likely going to be a real challenge with respect to the mandate is because when Congress wrote the Affordable Care Act, they didn't include what's called a severability clause. So when Congress includes severability clause, what that means is if part of the act is found to be unconstitutional, the rest of the act can remain intact. So if most of the law is fine, one part of it's not, we can sort of get rid of the problematic part of the act and keep the rest. Well, Congress didn't do that in the Affordable Care Act, which means that if the mandate is found to be unconstitutional, the entire act could fall. And this is going to be not only consequential from a PR standpoint, in the sense that this is the biggest healthcare law that's been passed since 1965, but tens of millions of people rely on the Affordable Care Act. So the Affordable Care Act included protections for people with pre-existing conditions. Kaiser Family Foundation study found that 27% of Americans have pre-existing medical conditions. Without the Affordable Care Act, insurance companies can deny people that coverage. The Affordable Care Act also included Medicaid expansion, and majority of states have decided to expand Medicaid. Even some red states, so notably John Kasich in Ohio, supported Medicaid expansion. So this isn't exclusively a liberal conservative issue. And Medicaid expansion really helps to deliver wide-ranging health care for lower-income Americans. So if the Affordable Care Act is found unconstitutional, that could go as well. So there are a few different ways that the court could rule on this. One is that they could find that the entire act is unconstitutional, which would mean that we're relying on the Republican Party, if they remain in power, to come up with an alternative plan. The problem with that is they've had since 2010 to come up with an alternative plan, and they don't really have anything in the works. So another option for the Supreme Court, and the one that I think is most likely, or was most likely prior to Ruth Bader Ginsburg's death, was that they could find that the mandate is unconstitutional as a zero penalty, and they could strike down the mandate as it stands currently, but then keep the rest of the act. So they could sort of interpret it to be severable, even though Congress didn't write it like that. Another thing that they could have happen is that it could, and for that to happen, Neil Gorsuch would have to rule with John Roberts, Elena Kagan, Sonia Sotomayor, and Stephen Breyer. Option 3 is that they could not resolve the issue. They could have it split 4-4, which means it goes back down to the Court of Appeals. This case originated in the Fifth Circuit, which is the most conservative circuit in the United States. So that leads to a lot of uncertainty, and likely would result in the overturning of the Affordable Care Act. So Mark Goldman says it's a very bad time to kill the ACA given the global pandemic. I agree. So not only, so while many insurers are covering COVID care, we're accumulating pre-existing conditions. So there are people who have survived. We've crossed the 200,000 mark of fatalities. But even though even in addition to the 200,000 people who have died from COVID, we have a lot of people who have been hospitalized. We have a lot of people who have accumulated medical conditions as a result of COVID. And those are things that would not be covered in the absence of ACA protections. We also know that people who are poor and people of color are more likely to be adversely affected by this. People who are poor might be living with more people, for example, which is going to increase COVID spread. There have been marked racial disparities. And when we have things like Medicaid expansion, we can help to deliver care. Whereas absent the protections of the Affordable Care Act, not only are people going to be concerned about accruing medical conditions that are being documented, but they're going to have a harder time affording going to the doctor. And so this is a really difficult time to be having so much uncertainty with healthcare going on. I agree. Another challenge that's going on with respect to the Affordable Care Act is the contraceptive coverage. So one thing that, but this came up a lot with the Supreme Court case of Hobby Lobby v. Burwell, where the Supreme Court it said that there could be religious exemptions for certain corporations to not have to provide contraceptive coverage free of charge. So the Affordable Care Act included what are referred to as essential health benefits. They said that each health plan has to provide things like primary care, laboratory care, prescription care, inpatient hospitalizations, things like that. So as well as OBGYN and maternal health care and things like that. Another and one key point of the Affordable Care Act was contraceptive coverage, and this was not the most controversial part of the ACA. The mandate was, but it certainly raised some litigation because there were some companies that, especially religiously affiliated ones, that were uncomfortable providing contraceptive coverage. So with the Supreme Court vacancy, this is definitely going to be coming up with respect to talking about what the next nominees' views are on contraceptive coverage, on Roe v. Wade, abortion more generally. So one thing that we want to think about when we think about abortion law is that the main Supreme Court decision that we really want to focus on is actually not Roe v. Wade. It's actually a 1992 decision called Planned Parenthood v. Casey. So when the Supreme Court upheld Roe v. Wade affirmed Roe v. Wade in 1992, they did so with some caveats. They basically said Roe v. Wade stays in the books, but states can enact their own restrictions as long as they don't impose an undue burden to the woman. But because the Supreme Court didn't want to make things easy for us, they didn't actually define what constituted an undue burden. And so what that ended up meaning was that there's a lot of uncertainty about sort of what kinds of restrictions can pass. And so there ends up being a lot of litigation over, is this fundamentally about preserving health and safety, or is this fundamentally about imposing an obstacle to the woman trying to get an abortion? But Planned Parenthood v. Casey is really the decision that you want to think about when you're looking ahead to who the next Supreme Court nominee is going to be. And so it's going to be there's going to be a lot of questioning on the Supreme Court confirmation hearings about the Affordable Care Act, because the Supreme Court's going to be hearing this decision, as well as their views on contraception and abortion more generally. There was a comment about the ACA being so expensive that they couldn't keep it. Yeah, so one of the things that that people really feel frustrated by is the instability of the market. That sometimes premiums ended up going up a lot. And one of the things that this actually reflects is the need to have a stronger mandate. So what the mandate was supposed to do was essentially say, we're going to make sure that a lot of young and healthy people end up buying into the market, buying insurance plans, and that's going to help to offset the costs for the older and sicker patients. That's the idea. So when we have premiums that are going up, in a sense, it maybe sounds counterintuitive, but it's actually not reflective of the mandate not working. It's actually, as intended, what it's actually indicating is that we just need to have a stronger mandate, because it means a stronger penalty, because it essentially means that we don't have enough younger and healthier patients who are buying marketplace plans to help bring costs down for the rest of us who might be heavier utilizers of care. So anyway, I thought that I would give people a general sense of the cases that you guys are going to be hearing about going into the Supreme Court confirmation hearing, thinking about what the future of healthcare is. Now that we have an eight-member Supreme Court, losing one of the main liberals on whom the left could count to preserve the Affordable Care Act as well as reproductive care. And some of the general concerns going into the election. I hope this was informative. I'll be coming back on in a few days to talk about what the Supreme Court vacancy means for affirmative action in America, and more specifically, what this is also going to mean for the state of California, which has a ballot measure that is aimed at restoring affirmative action to publicly funded institutions. So I look forward to discussing that with you in a few days. And have a great rest of the night. Take care.